Let's start with black stools. Honestly, as a family doctor, and I think most doctors feel this way, black stools can scare us because black stools can mean that there's some sort of bleeding that's happening in the gastrointestinal tract. That's right. Sometimes if the stools are black, if they're tarry, etc., we can call that melena. If it's bleeding, that can indicate an emergency, that there is something really, really, really wrong. And that's why black stools should always send you to be evaluated right away. Now, the thing about black stools is that it doesn't always mean that you have bleeding in your gastrointestinal tract. It doesn't always mean that. It can mean that you're taking certain medications, like iron or other medications. It could mean that you've eaten certain foods. Licorice can do it and others. But when we see and think of black tarry stools, that type of thing, even dark maroon, etc., bleeding always has to be ruled out because that is an emergency. Guys, I'm Dr. Jen. We're talking about stool colors of your poop that are dangerous potentially, that you should always be aware of. Now, let me say that this is not an all-inclusive list, although it covers some of the main ones. What I would say is if your stools change in any way from your norm, whether it's color, shape, size, consistency, regularity, any of that means you should go to your doctor, okay? We often call that a change in bowel habits, bowel patterns. Any change for you is a reason to see your doctor. But moving on about stool, what other stool colors get us worried? I would say white stools or clay-colored stools. If a stool is white, it makes me worried about an issue with bile. Okay, or rather a lack thereof, or a problem with the bile ducts, etc., which could ultimately mean a problem either with the liver or the gallbladder, the bile ducts, etc., pancreas. So clay or white stools should send you to the doctor right away because we need to make sure that you're okay. The next is sort of bright red or red stools. That is the stools where we see or we often worry about acute bleeding, bright red blood. Black stools, we're talking about blood that's dark. The bright red, we're talking about bright red blood. That can be due to hemorrhoids and other things, but it can also be due to something more serious as well. Sometimes medications may contribute, sometimes your diet may contribute, but overall, red stools need to be evaluated because we need to make sure that there's not blood there. And if there is blood, we have to understand where it's coming from and why. I would say the next thing is yellow or greasy stools, okay? Stools that kind of float. They are greasy. That is something that makes me worry or wonder about malabsorption. Maybe your body is not absorbing nutrients and absorbing fats and stuff the way it should be. Makes me wonder about a pancreas problem and other problems. So any sort of fatty, floaty, sort of greasy stools like that absolutely need to be evaluated. By the way, normal stool color is brown and maybe some greenish too, okay? That's a typical stool color. Any of the colors I mentioned absolutely need to be evaluated. Any change for you, change in consistency, how often you go, etc., all of that needs to be evaluated if that occurs. Let me know in the comments what your experiences has been, because sometimes what happens to you or what you go through helps other people when you talk about it here in the comments. Guys, I'm Dr. Jen Caudle, practicing family physician. Please follow me on, subscribe to my channel on YouTube, follow me on Facebook, I'm on Instagram, TikTok, LinkedIn, etc., everywhere. Go to my website, drjencaudle.com, to sign up for my weekly health newsletter. Guys, I'm Dr. Jen.